All right, it looks like we are live. Hello, everyone. Good morning, afternoon, evening, whatever time it is, wherever you're tuning in from. Welcome to another Tox Talks. If you've seen our little show before, my name is Alex from the Washington Poison Center. You know Fiorella from the Virginia Poison Center. You may not know two of our fantastic guests from the Michigan Poison and Drug Information Center. I just learned that they just updated their name, so that's awesome. Thank you all for joining us. So I'm not going to do a super long spiel this time. We're just going to dive right in. We're going to talk today about caffeine. A bit of housekeeping before we do that, though. Keep in mind, if you're tuning in through Facebook, you can put any questions or comments in that comment section, and if everything cooperates, we should be able to see that live and answer your questions as you have them. Worst case scenario, if it doesn't post during the stream, that's okay. Keep posting anyway, and we'll follow up later and answer the questions as we can. So I'll turn it over to our Michigan friends, and we'll dive into our little presentation. Thank you, folks.
Great, thank you, Alex. We'll start with slides coming up. So my name is Varun Vora. I'm the academic director and managing director with the Michigan Poison and Drug Information Center and clinical toxicologist. And I'm joined by my esteemed colleague, Dr. Andrew King, who's a medical toxicologist with our center. And we're going to jump right in. Next slide, please. All right, so caffeine is the word of the day. So it is the most common psychoactive component in the world, or compound in the world. So ubiquitous, it's universal in your morning coffee, which we probably all drank today. It's Monday after all. So it comes from a bunch of natural sources. So it can come from tea leaves. And as you probably learned in the history books, tea was an ancient, was a commodity in ancient history, throughout history, even still, as well as in the aforementioned coffee beans, which was originally cultivated in Africa and the Middle East, and now we know it coming from South America predominantly. And interesting little history tidbit, the major port city for coffee was Mocha, a town called Mocha in Yemen, which is where the mocha latte actually is derived from, which is the name at least, which is really interesting, as well as guarana as well, which is used by South American tribes, the seeds at least, to make caffeinated beverages that they use for medicinal purposes or to ward off illness as well. So it's everywhere. Next slide, please. So like I said, so we have a variety of sources. So they're in all beverages, variety of beverages, energy drinks, coffee, sodas, various powders as well, which are not FDA regulated. They do come pretty easily. They're easily accessible over the internet. Caffeine or anhydrous caffeine is a prime example. We have topical formulations as well as dietary supplements. So those pre-workout supplements that you've probably heard of, even products that propose or purport their thermogenic effects, which is basically a fancy way of saying that they increase body heat or metabolism for the purposes of weight loss. Again, majority of these are non-FDA regulated though. Next slide, please. And this is just an example, a very small sample size of the amount of substances that are out there that are attractive to more youthful demographic with fun colors, crazy names. And these are used ubiquitously, whether you add it to your water, have it before your workout, gain some energy during work, what have you. They're at every corner in most shops. Next slide, please. So this is a quick example of the caffeine content in a variety of products, whether they're tea-based products, coffee, soft drinks. And as you can see where I put the little stars there, you'll definitely feel that venti Starbucks, which has about 410 milligrams of caffeine. When you compare that to something like Diet Coke or Pepsi, it has significantly higher caffeine content compared to these drinks. So there are a plethora of products out there, beverages especially, as well as where people get into trouble with these kinds of products, with especially with the powdered products. A lot of times the dosing is quite confusing. Sometimes you'll hear directions of people recommending 1/16 of a teaspoon, which I couldn't even really comprehend what that looks like. So the dose threshold, or the threshold to get into trouble with caffeine, on top of these universal products that people are drinking every day, several times a day, can increase the risk of getting into trouble with these products. Next slide, please. So this is a little graph starting from 2010. So this is derived from the American Association of Poison Control Centers NPDS system, which stands for National Poison Data System. So this was the epidemiological sort of breakdown of energy drink exposures containing caffeine from 2010 to 2019. As you can see, then 2010 to 2012, there was a big jump in exposures. And it is conjecture, but this could be attributed to increased availability, accessibility, marketing as well. There still are a lot of commercials out there and advertising directed toward these products, and their co-formulation with ethanol as well. So there were a lot of products with caffeine products used with alcohol, which were really popular drinks, especially around that time, which kind of caused the FDA to start issue warnings for banning the use of ethanol in commercial caffeinated products. But most of those numbers, especially from 2010 to 2012, were driven by caffeinated products, especially with alcohol. And as you see, it's kind of leveled off or tapered off, but it's still quite high, and could be increasing actually, depending on what's happened in the last year, which we will look at the data for. Next slide, please. So caffeine does have actual medical uses or pharmaceutical uses. So two main indications for caffeine include apnea and bradycardia syndrome for prematurity. So essentially what that means for premature babies, they will have episodes of big breaths or bursts of breath followed by very shallow breathing, and sometimes pauses in breathing. And that pause or shallow breathing can lead to decrease in heart rate or bradycardia. So caffeine can be used to help treat that condition, as well as used for pain. So you might see common products like Excedrin, so migraine relief formulas with acetaminophen, aspirin, and caffeine as well. And the reason why it works like that is because it's involved in pain regulation, or the receptors that it hits are involved with the modulation of pain. Next slide, please. So as far as how it works, so to break it down into simplest terms, so caffeine, we know it stimulates the body, right? So it kind of revs everything up. So what it does and how it achieves that, it essentially binds to a receptor called the adenosine receptor. So adenosine normally slows down the body. You can think of it as increasing the inhibition or inhibitory tone of the body. So essentially caffeine is inhibiting that receptor. So it's inhibiting the inhibitor, which results in stimulation, more stimulatory effects on the physiological systems. Next slide, please. So as far as caffeine exposures, it can occur via all routes. Like I mentioned earlier, they're available in beverages, liquids, topical formations as well. And its effects typically take place within a half an hour to within an hour. Safe range is typically less than 20 milligrams per kilogram of body weight. Children and newborns are typically at higher risk. One of the reasons is because of some biochemical functions that newborns can facilitate, that can place them at higher risk for caffeine toxicity if exposed to other substances, as well as just based on sheer body surface area. It doesn't take as much for them to get into trouble with these products. And now I'll turn it over to Dr. King.
Hi, everybody. Now, we just talked about the basics of caffeine, but let's talk about the toxicity of caffeine, because we are, in fact, from a poison center. I don't think, Vern, have we ever had anyone call and say, like, I had my coffee this morning and I'm feeling pretty awake now. So, yeah, I don't know how those phone calls would go. They just kind of, maybe they'll ask about it because we are the Drug and Information Center now. Maybe they want information about caffeine. Is that how that would work? Is that why we changed our name?
Michigan Poison and Drug Information Center. So that's what we are. So we've got the answers. You got the questions.
Look at us, like, hitting all of the the basics of our charter right now. Like, we are giving information out to the people, and this is making me happy right now. Let's go to the next slide, because let's talk about actual toxicity. And there's a little bit of delay in between slides, so I'll see if I can make this as smooth as possible. There it is, right? Now, you can die from caffeine, right? Lethal doses have been described in adults, and usually those are associated with the serum concentration or a blood level. And that takes a lot of caffeine to get that to happen, right? If you're doing about 200 milligrams per kilogram, a quick, although previously done mathematics, is about 35 cups of like the Starbucks coffee, which I can handle maybe one and a half before I get too shaky or nauseated. So it almost never happens with any caffeine products like coffee, for example. But as Vern brought up before, some of these highly concentrated anhydrous caffeine products that you get maybe to take pre-workout, or there's a bunch of caffeine pills out. I don't know if anyone is a Saved by the Bell fan, because you'd shown your age if you were, but Jesse Spano had a problem with some caffeine there. I'm just throwing that out there. I'm getting some smiles, and so that makes me happy that I'm not the oldest person in the audience. But, and I can't see anyone in the audience, but that's the idea, is that usually people get into trouble when we're talking about the highly concentrated forms, because or they might start having some side effects from drinking way too much coffee all day, every day. And we're going to get into what those disease processes are in a minute. So let's have the next slide. I do like these visuals, whoever put those in there. That's a good one. So, caffeine affects all your different body systems. And so we're going to talk about toxicity in each one of the organ systems, just so we can kind of break it down and then put it all together at the end. First one is obviously nausea and vomiting. And I think many of us out there who've had a bit too much coffee, we can feel shaky and a little bit nauseated, like I'm good. It does increase your gastric secretions, and it does cause some smooth muscle relaxation in your GI tract. And so a little upset tum-tum is not unheard of. And then when you talk about toxicity, the vomiting can be pretty magnificent, and it can be protracted. And so when you have someone get into anhydrous caffeine or a bunch of caffeine pills, like that's, unless they're coming in vomiting, I'm going to be a little suspicious that's actually what's going on, because the GI pyrotechnics, if I can use that terminology, can be pretty amazing. And not only are they vomiting, but they are sweaty as all get out, and you can't put leads on people. It's a big mess. Next slide. Next one, I think, is cardiovascular. There you go, cardiovascular. So like Vern said, this really just increases the catecholamines, or the adrenaline, for lack of a better term, in your body. And that means that your heart is going to be racing, and you might feel this a little bit jittery and tachycardic, or you can feel your heart rate elevating. And that's what happens with caffeine. As we said, it's like the double negative, like the inhibitor of the inhibitor. And that's one of my favorite things to talk about in toxicology, is like that thing inhibited the inhibiting inhibitor. So then it's more. I don't know, right? Everyone on the call knows, of the people I can see at least, exactly what I'm talking about, right?
It's science.
It's a science, right? And so, it does that. So it's going to increase heart rate. It's going to increase the contractility of your heart. And then if that's too much for your heart and your heart system to take, sometimes you can go into funny rhythms and then cause you to pass out, or your heart to beat way too fast, and you can actually have cardiovascular collapse and dysrhythmias or funny heart rhythms from that. On top of that, it does generally cause vasoconstriction, and that is one of the reasons that we'll use it for headaches. If you have for its vasoconstricting effects, that can help a bit with people who have migraine disorder, for example. But high blood pressure and increased heart rate is something that we can see with caffeine. Next slide. I'll take a step back, actually. But with that, like if you get super duper sick, then the high blood pressure and the high heart rate can actually flip on you, and you can have really low blood pressure or wide pulse pressure. And that can be from a bunch of different reasons, but that's a little bit outside the purview of this talk. So let's talk about neurologic toxicity. So everyone knows that caffeineism is a potential etiology for some of the neurological effects that we all get. And we may have all suffered a little bit from this, right? Like you drink a lot of coffee and you feel a little anxious, maybe agitated. It can make it difficult for people to sleep at night, especially if you drink coffee throughout the day and maybe start doing it too late at night. Tremor, like we talked about. Hallucinations, I haven't ever personally experienced any hallucinations, but I suppose it's possible. Or maybe I misattributed the hallucinations to something else and it was actually from the coffee. I don't know. And then seizures are a big deal, right? That is like the worst part of caffeine, because remember, you're inhibiting the inhibitor. And so it makes it real difficult to get the seizures under control if they start happening. And then that's one of the reasons where we decide to go really crazy with people and start dialyzing off caffeine, which we'll get into at the very end. Next slide, please. So the seizures, it can be, like I said, refractory, and they can be really difficult to control because the medications that we'll use to treat seizures don't really get at the underlying mechanism of why seizures are happening to begin with. Now, there's no adenosine that we can get that crosses the blood-brain barrier and gets into the brain itself to stop the seizures from happening. So if seizures do happen, they can be really difficult to stop with the usual medications that we use to treat seizures. And so we'll start increasing, the aggressiveness of the medications we will be giving to stop the seizures. And then all the way from benzodiazepines, which you may have heard of, to barbiturates, to propofol, etc. But just realizing that when they start seizing, we start getting really, really concerned about somebody if we hadn't already been concerned about them. But we try to be very aggressive about shutting those down. And then here's a fun fact for everybody. Like if anyone's at a cocktail party with the mayor, I don't know, and you're wearing your tuxedo and you're walking around looking at fancy art and ice sculptures. I don't know how many parties there are out there like that, but I would say, hey, did you know that caffeine used to be used to prolong seizures during electroconvulsive therapy? And that's a great way to enter a conversation, especially with like fancy people. I don't know, people who have monocles, you definitely should enter that conversation.
July's a good month. July's a good month.
Top hats and monocles. I don't know who's got those anymore.
Mr. Peanut.
That's true. It can also affect a lot of your electrolytes. So it can cause low potassium, low magnesium, low phosphate, high blood sugar. You can see some of those. And a lot of these things happen just in general when your adrenaline goes up in your body system. It's not one of the things that we pay too much attention to as when we're managing people with caffeine toxicity, but it's just something to be aware of. So let's go to the next slide after that. So there are caffeine-related psychiatric disorders that are classifiable in the Diagnostic and Statistical Manual of Mental Disorders, which is what our psychiatry colleagues use to determine mental illness, right? And these can, these run on the gamut from, like mild to major or severe disease processes. But here's a couple of the ones that they actually do have in the psychiatric manual. And so that can be caffeine toxicity, which we're talking about right now, caffeine withdrawal, which we've all, well, at least those of us who misuse caffeine have probably dealt with. Then there's a caffeine use disorder, and that's a similar thing. Like most substances can develop use disorders, and when it becomes a problem for many reasons, and it's affecting some of the your social life, your occupational life, then it can actually turn into a use disorder, and you're using it despite all of those consequences. That's when we started classifying people with a use disorder. And then, there's a couple of other caffeine-induced disorders out there, like difficulty with sleeping and caffeine-induced anxiety. And all those can very much be treated by, reducing or decreasing caffeine. But caffeine use disorder, that one's an interesting one to tackle. Let's go to the next slide. So when someone comes in very sick, we got to decide what to do. Now, say someone overdoses on their caffeine pills or their anhydrous caffeine, we got to decide, should we get it out of their body? Like, how are we going to keep that caffeine from being absorbed? Now, there's a couple of things that we can do. We can do the old stomach pump. If you remember, it depends on how old you are. If you have as much hair as I do, that would be something that toxicologists and physicians used to do a long time ago. Now, gastric decontamination is not just the pumping in the stomach. We can actually give people things like charcoal to absorb onto that toxin so it doesn't actually get absorbed into the body system. Or you can even put something in their system to help blow it through, like a go lightly, kind of a colon prep idea. Now, for caffeine, most of the time they're already self-decontaminating. Like I said, the vomiting can be pretty amazing. And so there's not a whole lot of reason to do it. On top of that, the caffeine is usually very quickly absorbed. And so by the time you would even think about, doing a stomach pump or given charcoal, it's probably already absorbed and you're not going to get a whole lot from it. Plus, we got to decide whether or not that's the right thing to do for the patient. Sometimes you can cause more harm by trying to do these things than good. when you're taking care of a patient who's acutely toxic. Now, the hemodynamics are really interesting. It's one of my favorite things to talk about because, like we said, it can cause high blood pressure and high heart rate. But then when you get very sick, sometimes the blood pressure we get like a wide pulse pressure or just overtly low blood pressure it's just too much for your system to handle. And so one of the things that we may consider doing is giving something to help with the squeezing of the vessels. If that becomes a problem, we might have to give some medications to slow the heart rate down. If it's just too much, if it's going too fast and then the tank can't fill before it squeezes more blood forward, then sometimes we have to slow that down. And there's various pharmacological medications that we can give for that. Neurological, we talked about before. The seizures we try to jump on top of as aggressively as possible because it's not fun to have a seizure. And then that leads me into the final part is that if someone is very sick, just in general, we kind of add this all up. And when patients are very, very sick from caffeine, sometimes we have to put a dialysis catheter and actually just remove it straight from the blood if they meet some criteria. We don't do it for everybody. And many patients we can get away with just giving certain medications and some time for their body to remove it. But if they've taken way too much, then we just got to get it out of there. And there's no two ways about it. Next slide. And so we were going to bring up a couple real cases. I wanted to let Vern do his first, and then see, because I mean, they all can kind of come in very similarly. They can come in like meteors, man, like super duper sick, and you got to get something done like ASAP. And so I just want to see if your experience is very different, or if there's anything else that I can add on top of yours. So I'm just going to throw out it's case time.
Yeah. So the case that I was consulted on now probably a year and a half, 2 years ago, stuck out to me. It was a 31-year-old male who came in. He was dizzy. He was confused. His heart, he was tachycardic. He had a fast heart rate. He had chest pain as well. And then within, half an hour of his exposure, he presented to the emergency department. And then he was kind of had pre-syncope, and became really agitated. And then, like you said, GI pyrotechnics, he was vomiting profusely. So, what he had told the staff initially was that he took a pre-workout supplement, anhydrous caffeine. And as soon as I heard that, I was like, okay, the threshold is going to be really low. And again, like I mentioned before, typically you'll see these weird oddball recommendations. Do you know what a 1/16 of a teaspoon looks like, Andy? Couldn't tell you, right? So apparently he said he took a full teaspoon or, half a tablespoon. I can't remember exactly how much he said he took, but what it amounted to was near 20 times the amount of caffeine that he should have been taking, which, hallmark signs and symptoms that he came in with neurologically. He did experience a seizure. His potassium was really low. He had a wide interval, tachydysrhythmia, wide QRS. So we got on top of it. We managed it pretty well initially. Luckily, he came in within a short period of time from the exposure. And we, with IV fluids, resuscitating with IV fluids. We gave him propranolol to help control his heart rate, which is a beta blocker. Followed that up with potassium repletion. He was in the hospital for about 2 days before being discharged, but his heart rate was still elevated after that long. So they recommended a 3-day course of propranolol even upon discharge. So that kind of gives you an estimate or an idea of how significant these effects can be and persistent. So he got lucky. We were considering dialysis at one point, but one thing that should be said is, with serum concentrations of things like caffeine, there are textbook answers. However, in acute clinical situations, sometimes you don't have the time to wait for a level, right? So you have to make kind of a judgment call in that perspective. Luckily, his symptoms did resolve, and he became asymptomatic. And it was luckily an accident, not a intentional self-harm. But this goes to show you the narrow range that exists between therapeutic effects and toxicity.
And this was in New York, right? Because this is eerily similar to the one that I dealt with. Yeah, so it's the same thing. I don't mean to one-upsman you, but
no, not at all. I'm used to it.
Got into a lot of caffeine, and I'm not quite sure, but he was a young bodybuilder, and it was the worst thing ever for the nurses because he was super hairy. Like, he was a bodybuilder and he was super hairy and he was super sweaty. And so this guy is just kind of dripping and his heart rate's like 1,000. And so, we ended up giving him the same idea as we gave him the beta blocker. His blood pressure was kind of dropping. He started having some, bad heart rhythms on the monitor, and that became pretty scary for us. And then so we ended up dialyzing him pretty quickly. But I just remember the nurses just being exacerbated by dealing with all of the hair and the sweat and trying to put leads on somebody. They just kept coming off. It was like Teflon, like nothing would stick to it. And it was really frustrating for them. But the guy did very well. It turned out to be like a semi-suicide attempt. And so I'm very glad that we dialyzed him. And ultimately, he got the care that he needed, but he was a bit touch and go there. So.
Yeah, so there are other products. Andy did mention, sleep disorders and whatnot, and there are products that people use to kind of keep themselves awake, right? So I think there's a product called Overdose, which is pretty popular, that have been consulted on before. Luckily, not too serious, but again, all these products are out there, and I think the important part is that they're not regulated from an FDA perspective. So what that essentially means is that the manufacturer doesn't have to provide evidence essentially of safety or efficacy, or it's not undergone a rigorous scrutiny from a federal organization. So people need to be aware of that.
That's a good point. I just want to throw out there that caffeine is a toxin, right? The dose really makes the poison, as we all love to say in toxicology. And then when you go back and you look some of the slides that we had previously, you can see that there is a lot of caffeine in these pill products, right? Or in these bottles. And I mean, you can get them on certain online vendors for not that much, and there's a lot in there. And so we just really want to be careful with the products that we have around the house, especially if you have someone with a history of overdosing or maybe depression or some other mood disorder, that we want to keep those things safe as well. We always talk about medication safety, but let's not forget supplement safety. And this definitely falls under, those auspices. And so we just need to make sure that we keep the stuff there. If we have, someone we're worried about, I think it's good to keep those things locked up.
So from listening to all of this, so I do a lot of social media. And one of the things that I saw, or pretty much came across my, I would say my Twitter and my TikTok, was the dry scooping challenge. I don't know if you heard of the dry scooping challenge, but so basically it refers to putting a scoop of pre-workout powder in your mouth instead of mixing the powder with water or another liquid and drinking it as it is intended. Okay, what kind of problems do you foresee that would happen from this? And this is for the docs.
I mean, if we're looking at it from a straight milligram per kilogram dosage, I mean, it's not really going to change the amount that is absorbed. And to say oral absorption of caffeine, it's almost 100% in terms of its what we call bioavailability. So it's the amount that's reaching your system unchanged, so that it hasn't been metabolized or altered in any way. It almost kind of reminds me of the cinnamon challenge in a way that I think that'd be super uncomfortable, just with that amount of dry powder in your mouth. But from a toxicity perspective, I don't know, Andy, correct me if I'm wrong, I don't see it being a major issue unless they're taking more than they should be to begin with.
I guess it depends on what else is in the scoop too.
Right.
If it's just caffeine, that's one. But if there's other things in there that potentially could be more irritating to the lungs, I think it would be a case-by-case basis. We would 100% recommend don't do that.
Yeah.
Just want to make that, I think, a general statement. I think everyone can agree that that's not a great idea. But be careful. And then it really does depend on the dose that they got into. If it's like a typical dose, then we wouldn't necessarily expect significant toxicity, but just not a good idea. So let's dissuade people from doing that.
And I think one important, last point would be, a lot of people associate, calling the poison center or getting into situations with an overdose as, oh, that can't happen to me, right? Like an overdose, that's crazy, that's extreme, right? But again, with certain drugs or certain compounds that it doesn't take a lot to get into trouble. Say someone is an avid coffee drinker, as it is, coffee's fine, right? But on top of that, let's say they take some pre-workout, a lot of it, still within the recommended dose, or frame, therapeutic dose range, you can still get into potential issues. Even if it's not seizing or whatnot, it could make you nauseous, you could start vomiting, you could start having some issues, some neurologic issues. So just be on the lookout for it and be cognizant of that intake, since it is everywhere.
All right. Well, thank you both so much for walking through all of that. I learned a lot just in that slide deck. I learned a new term, gastrointestinal pyrotechnics. I'm going to use that more regularly because great term. Learn to not have.
That's right. Yeah, we got that, man. That's ours. Michigan.
No, okay. I'll reference each time. I'll give credit where it's due. I'm going to cite my source. And yeah, don't drink 35 cups of coffee, please. Don't have that magnitude of coffee. And if you ever have any questions about caffeine, coffee, if there's an active concern, or just, hey, I'm curious about the supplement, what can you tell me? Give the Poison Center a call. This number here, 800-222-1222, will route you to your local Poison Center based on your area code, and we all can give you the same kind of recommendations and treatment advice. This has been an excellent session. Super easy for Fiorella and I. We just got to kick back and push slides. So thank you all for attending. I don't see any questions in the comment section. Other than a rather timely comment of time to bust out the razor when you were talking about Mr. Hairy Sweaty. Also learned that hair and sweat gets in the way of putting leads on. Hadn't thought of that before. So does anyone else have any final thoughts or comments before we sign off for the day?
If you'd like, I can leave a contact email address if anyone does have any questions that they want to follow up on. If that's acceptable, I'm happy to do that.
Yeah, perfect. We can go ahead and put that in the comment section itself too.
Okay. Now it's not letting me type. Okay, I'm just gonna put it in here into the chat, and someone hopefully can copy and paste it because I don't think it's working for me.
No problem. We'll be able to put that in. Even when the stream ends, we can put it in after the fact.
Great. Thank you.
All right.
Well, we had a lot of fun. Thanks for the invite.
Yeah.
I hope
Absolutely.
well received.
Perfect.
Thank you so much. Yeah. I mean, if you like this stream, go ahead and share it. We're probably going to keep it for at least a couple of days. So feel free to share it. Other people know more about caffeine and the dangers associated with it. Thank you.
All right. And keep an eye out for the next Tox Talks. Thanks, everybody.
Thank you. Stay safe.